Good evening, parents. We are delighted to have you join us in this informative and interactive live session on stem cell banking. God bless stem cells offer life saving potential. Hi, Dr. Sithara. Welcome to the session.
Hello, Caroline. Good evening.
Right. God bless blood stem offers life saving potential. Preserving them is a decision every expecting parent should understand fully. Today's expert led workshop covers timing, collection process, bank selection, quality standard, costs, and diseases treatable today. We are privileged to have Dr. Sithara C S, experienced consultant at Cloud9 Hospital with MS OBG from KS Hedge Medical Academy and fellowship in reproductive medicine. Dr. Sithara has guided thousands of parents through pregnancy decisions, including stem cell preservation. Dr. Sithara, thank you for being here. Please do share your thoughts on why stem cell banking matters for Indian families today.
Hello everyone. Good evening, all the parents there. Yeah, stem cell is the future because you're helping to prevent a lot many. It helps in curing or treat many diseases like leukemias, lymphomas, thalassemias, sometimes like aplastic anemias as well. So I think going forward, it is the future.
Thank you, Dr. Sithara. Before we dive deeper, I'd like to remind the parents present here that Dr. Sithara will answer your live questions. So let's dive in. I'd also like to encourage parents to share your questions in the comments. We'll cover as much as possible today. Dr. Sithara, the first question's coming to you, and that is, when should parents make the decision to bank stem cells? Is it during early pregnancy versus last trimester?
So, ideally, the parent should explore the cell banking early in the pregnancy because there is enough time to understand the consent and the medical what all is required, and also there is a lot of time to choose the what kind of banks they want to choose, and also discuss with your gynecologist. So, the early pregnancy is definitely the time that the parent should think about it, and decisions that are made late in the pregnancy, they may feel rushed and could limit the preparation.
Right. You did mention choosing a stem cell bank, and that's what my next question is going to be about. How does one choose a reliable stem cell bank in India?
So parents should look for proven experience and also track and record. And also there should be some amount of transparency in processing and also storage protocols. The laboratory that you choose should be accredited, and it should be compliant with all the Indian regulations. There should be some amount of clear policies for sample access, and also a long term storage is definitely necessary. The storage lab infrastructure and disaster recovery is also important. So I think the parents should look for all this before they dive into the stem cell banking, if they want to get into it.
Let's say, Dr. Sithara, one is doing this for the first time. There are parents doing this for the first time, and they go to choose a stem cell bank. You said accreditation, right? Are there specific institutions that these stem cell banks need to be accredited to?
Absolutely, it should be the Indian regulations should be they should have to follow the Indian regulation. Some reputed and scientific credibility definitely matters.
And how does one decide if there is credibility behind the stem cell bank they've chosen?
So, as I just mentioned, there should be a proven experience and there should be a track record of it.
Okay. All right. Dr. Sadaran, my next question is, what exactly happens during cord blood collection at birth?
So after the baby is born, the umbilical cord is clamped, and then we deliver the baby to the pediatrician. So following which, the blood that is remaining in the cord as well as the placenta. So just to give a little bit of anatomy, there's a baby, there is an umbilical cord and also the placenta. Basically, the baby gets its maternal blood through the umbilical cord. So what we do is, once we cut the cord and we safely hand over the baby to the pediatrician, that is when the blood that is remaining in the cord in the placenta is collected, that too in a sterile kit. So the process is very painless and it is safe. And definitely, it's not going to interfere with the delayed cord clamping or during preterm birth. The collection takes around 2 to 3 minutes or a maximum of 5 to 10 minutes.
Right, and moving on from collection to the actual process, Dr. Sitara, how does the process work for IVF pregnancies, twins or multiples?
So it's essentially the same. The IVF pregnancy, there's no difference in any kind of eligibility or the safety. Twins or multiples also is it. The key factor is what we need to understand is there should be adequate volume with the medical team assistance should be there. So there is definitely, and in also in twin pregnancy, I would like to say that it's labeled differently for different babies. So there are different kind of twins, but still we have to. There are twins with two placenta and two cords. So we collect the blood in two different sterile kits.
Okay.
So it's the same process.
Right. And when you say cord blood stem cells, which diseases can cord blood stem cells treat today in India versus globally? I feel there's a lot of lack of knowledge with regards to this.
So some metabolic disorders or kind of immune disorders. There is a kind of anemia called as aplastic anemia, thalassemia, or basically something related to blood. Okay, bone marrow blood, like leukemias, lymphomas, can be certainly treated.
Okay. And what preparations are needed before the delivery for smooth collection?
So first thing is enrollment and consent before the delivery for sure. So that is why I mentioned that it should be early pregnancy. We need to decide about it. There should be a maternal health screening and medical history. Of course, this is what every patient goes through her during her antenatal checkups. Informing the hospital and the delivery team, especially the doctor. The doctor here plays a main important role. Ensuring the collection kit is available. So once you enroll into this kind of banking, the gynecologist is informed about it. I think the gynecologist and the system takes care of it. All that you need to know need to is keep the gynecologist informed about the same.
Okay, Dr. Sitara, also, is there any way you think stem cell banks ensure sample quality and viability?
Yes, absolutely. They have the sterile collection kits, and there's a temperature controlled transport, processing in good laboratories, and also cryopreservation using validated freezing techniques.
Can you expand a little more on the cryo techniques that you mentioned, Dr. Sitara? It's very interesting to know.
So basically, cryopreservation is nothing but the cell is freezed at a particular temperature. That is nothing but cryopreservation. So it
Okay.
happens in the laboratory where a temperature standard is maintained so that the cells don't multiply or the cells don't get, in simple words, in a non-medical world, basically they don't get spoiled. So you kind of freeze it at a particular temperature.
All right. And when it comes to families, Dr. Sara, what do you think is best for them? Is it private banking versus social banking? Which one works better for families?
So social banking is basically it is for a different purpose. Social banking is for donate if you're donating it for anyone or in case they need access later for this kind of social banking. But in private banking, it is stored exclusively for the family's use. It's one to one. It's not to the public. Definitely, as a choice, unless you are thinking of donating it to someone, you should take it for private banking.
All
And
right.
also
And
depends on the medical history, awareness, and personal priorities.
fair. And are there any safety or quality standards that parents, should verify before choosing? I know that you said experience of the bank matters, but when it comes to safety and quality standards, what would you recommend?
One is laboratory certifications. You must go through it. You must also ask them that if I have to want to trace them in future, like for example, the family moves abroad. So then how do you trace it? What happens? So you need to talk to your stem cell bank, that what happens to it. Do you discard it? So that kind of you should be able to have a transparent tracing system. And there should be also some backup and storage for these stem cells, and also regulatory approvals by the government of India should be definitely be met.
Okay, and when it comes to costs, Dr. Sitara, what are realistic costs, and are there flexible payment options available for stem cell banking? I know this will be a question on a lot of people's minds as well.
So it's a one-time processing fee, and there will be some amount of annual or long-term storage fee also will be there. Annually you may have to pay some amount. Many of the banks have installments plans or long-term options too, which actually help the families in because otherwise it is a financial strain. I think there are installment plans which is given by a lot of stem cell banks.
Right. Thank you, Dr. Sitara. Before we move forward to the next question, I would like to remind our parents that Dr. Sitara is here to help you understand stem cell banking, and send in your questions, and we'll try to take in as many as we can. Uh, and Dr. Sitara will answer them for you, of course. Great. Dr. Sitara, moving on to our next question. How do banked stem cells remain viable and usable?
So bank stem cell, basically after the cryopreservation, we spoke about the cryopreservation. Once you cryopreserve the stem cells, they remain viable for a decade. So there is no defined expiry date when stored under optimal conditions. But I think, we are under research.
Okay. I'm going to take a parent question over here, Dr. Sitara. We have Mamta, who asks, we're having twins. She says, we're having twins. Do we
Mhm.
need bank for both or just one?
So it is highly recommended to bank for both. While identical twins share the same DNA, there are often born with um, uh, you know though there are two kind of twins basically. One is identical twins and non-identical twins. So when one of the baby is born with a lower birth weight, meaning the volume of stem cell in a single cord may be very less. So collecting from both ensures there is adequate cells for treatment.
Okay. That's really informative, Dr. Sitara. I'm going to take another viewer question over here. This is from a parent called Jyoti, and Jyoti asks, why is birth the only time I can collect these specific samples or these specific cells?
So sorry.
So Jyoti asks, I'm going to repeat the question. Jyoti asks, why is birth the only time I can collect these specific cells?
So the umbilical cord is the only. Are you able to hear me?
Yes.
Yeah. So the umbilical cord is the only source of newborn stem cells, which are younger and more resilient than those found in adults. So once the cord is discarded as a medical waste, the unique opportunity to capture the cells is basically it goes away. So that's the reason that it is important that you collect the cells from the umbilical cord.
Okay. Dr. Sara, I'm going to take one more parent question before we get back on track. And this is from a parent called Ananya. And Ananya asks, till what age can stem cell banking benefit my child?
So basically, there is nothing like a particular age till which it can benefit. See, as I said, that definitely for a decade, we are still under research. So I think it's an open-ended thing that maybe forever. Imagine the diseased person. It gets a aplastic anemia when she or he is like probably 60 years. So it can still work.
Okay. And can stem cells from siblings or family members be used?
depending upon the what kind of disease, if there is a, we do something called as HLA matching. In case if the match happen, then it still can be used.
Okay. And what if delivery happens unexpectedly? So let's say a C-section or preterm.
See, if it is an emergency cesarean section, but still, if you just put in a word, I think if it is like preterm, emergency, and still there can be a system that works that you just, because we are not hampering with the medical, the patient can be taken up for cesarean section and on an emergency basis. But if you just happen to tell a word to the doctor in prior, I think we can still make it.
Okay. And I'm just gonna go back to the costing of stem cell banking, Dr. Sithara. We have another question from a parent, Ananya, and she asks, is stem cell banking covered by insurance?
Currently, I'm not sure if it'll be correct, kind of covered by insurance or not.
Okay. All right. And how infectious, Dr. Sithara, is
However,
disease?
as I just mentioned, I think the stem cell banking have this option of, they have a one-time processing fee as well as an annual or a long-term storage fee. So I think that way they kind of help us with the finances.
All right. And how infectious is disease screening handled during collection?
So maternal blood is tested for infection as per as medical guidelines. Samples are only released for the use for after mandatory and safety screening.
And what's the success rate of? I'm going to go back, of course, to now the family bit we spoke about earlier. What's the success rate of stem cell transplants from cord blood?
So it depends upon the what kind of disease it is, what is the patient condition, and also the what is the cells that is there, and also the match quality. So for many pediatric blood disorders, the outcomes are comparable to that of the bone marrow transplants, and when appropriately treated.
Okay, I'm reading some more parent questions, but I believe we've answered these earlier, Dr. Stara. If you want to, of course, delve a little bit further into these. Jaya asks, how long will cells remain viable in storage, which you've answered, but you can give us a little
Yeah.
more information on it.
Yeah, the current research, it kind of shows in 2026, the shows that the cells stored at minus 196 degrees Celsius, it maintains a very high viability after even 25 to 30 years. So theoretically, that as long as they are kept at these cryogenic temperatures, the biological clock is stopped indefinitely.
Right. And there's another question we've answered earlier, but if you want to, of course, give us a little bit of a recap on this. Prerna asks, how does community or social banking work? We've covered this.
Okay. So community banking allows you to Okay. Community banking allows you to share your samples in a private pool. If your child needs a transplant, but their own cells aren't suitable, for example, in some kind of genetic condition, you have the priority to access thousands of high quality matches. So that's how community or social banking works.
What about Dr. Sitara, government regulations? Are there any government regulations you think parents should know about?
I think the stem cell banking will take care of the government regulations only when in India the stem cell banking and are used by guided by some like national biomedical and ethical guidelines, and also there is licensing and oversight of laboratories that is done only after which the stem cell banks get their permission. There is definitely restriction on unproven therapies. So parents should be cautious of claims beyond approved uses.
Are there any unproven therapies or uses that you've heard of that have completely stunned you, and you obviously want to warn our
No,
parents?
I haven't heard of anything as such, because most of our parents have gone to a good cell banking, and the guidelines are very clearly mentioned. So I think I haven't heard of anything as such as of now.
All right, Dr. Stara, how does we're going to continue? How does storage technology ensure long-term cell potency?
So the cells are stored in liquid nitrogen at an extremely low temperature. As I mentioned, it is around minus 196 degrees Celsius, and it is monitored systems with alarms and also backup. So this state kind of it is very effective to pause the biological aging of the cells.
And what happens if, and I believe you have answered this previously, but these questions keep coming in, so I'm just going to direct them to you. Feel free to delve into it a little further. What happens if parents move cities or countries after banking?
So basically, the stored cells are safely preserved in their original facility. If required, if at all, if the parent asks for it, then international transfer protocols exist and subject to once again the regulation and the medical need.
All right. I'm going to take one more parent question while we're at it, Dr. Sitara. This is from Abida, and she asks, is the collection process painful for my baby?
No, no, absolutely not. So, as I just mentioned, once the cord is clamped, cut, and the baby is handed over to the pediatrician, that is the time we kind of the collection happens after the baby is born and the cord is kind of free. It's clamped and it is. So, that's the reason there is no way that the baby will be harmed or anything for that matter.
All right. We have another parent question I'm going to take before we move on, and uh, this asks: is cord blood collection safe for both mother and baby?
Yes, it's absolutely safe for both and mother and baby. I think no parent should be thinking about it or being worried about it. It's definitely safe for both the mother and the baby.
Right, and there are no risks involved. You mentioned, right?
No, there is no risk involved.
Okay. What if there are complications during delivery? This is another parent question. This is from Tisha. She asks, what happens if there are complications during delivery?
Even if there are complications, see, one thing we need to understand is once the baby is delivered, the baby is handed over to the pediatrician. So that part is over. The baby is safe. Now, coming to the mother, the placenta and the cord has to be anyways out and it is a part of the surgery. Whatever complications, like there could be abruptio, there could be anything for that matter. There could be PPH or postpartum hemorrhage is one of the complications that we see. For that matter, we need to remove the cord and the placenta out. So it no way that we are going to harm the baby and the mother. So whatever complications, one thing is there will not be a complication just because you are planning for a stem cell banking. Second thing is the complications will be handled on its own. We just remove the placenta and the cord and we hand it over. So your gynecologist actually doesn't kind of think of doesn't deviate her mind for this. And moreover, even if there's such complications, it will be handled once the cord and the placenta is handed over to the second person. That will be taken care. And any which ways, there is no such ways, but any which ways, if there's a complication, do not be worried, parents. I think the first priority for any doctor would be a mother and the baby. So the blood cells will be just kept aside. So we are not going to deal with it. Such complications will be handled first. The mother and the baby is of importance first, and only then we'll think of the future.
Right. You did also mention post hemorrhage. Is there any way to, you would say, prevent hemorrhage at all?
Postpartum hemorrhage, to prevent, there's no prevent, we give some amount of injections to prevent. Some doctors routinely do that, give that, like carboprost, or these injections oxytocin is added during the delivery. So these are the way we prevent hemorrhage. So it depends upon the amount of blood loss also.
All right. I'm just going to take a couple more questions from our viewers, Dr. Sitara. This is
Yeah.
from Justine. And
Mm-hmm.
she asked, what documents do we need for stem cell banking?
So I think it is the maternal's medical history, and then we need to know about whether the baby is it her first delivery, the second delivery, what kind of medical history, if at all they're already having a medical history like thalassemia or any kind of genetic disorders. So these are the primary documents that you need to give them. So one thing is any kind of diseases that the mother is having, or the genetic diseases, or in case of serology. Serology is something that we take care before we even deliver. So these are the documents that you need to provide, and other things like your Aadhaar card, address. I think those are the things. So medical related, it's more of medical history, genetic family, genetic history, and from both maternal and parental side.
Another user question here, another reader question. This is from Arushi, who I think asks something very relevant and something on most parents' minds, which is, why is stem cell banking expensive? Do you think it's a supply demand thing? What is the?
No, but what we need to understand is we are cryopreserving it in a bank. Like, you kind of keep it in a preservation where it is minus 196, and those banks require a space to do it. We need to keep it, and we need to make sure that it is available any time for the mother. So that's the reason it's a little, if you think that it's on the expensive side. So it's almost like an insurance, that you never want to use your term insurance, but then we kind of keep it so that way.
It's interesting. It's interesting you mentioned the insurance bit and, of course, preserving it, because our next question is very relevant to what you just said. Uh, One of our parents asks, "What if the bank goes out of business? What then?"
So reputable banks have there's something called as disaster recovery. So plans and are often required by the regulations to have agreements with such other facilities. So therefore, you don't have to be worried. If one bank closes, your samples are typically transferred to the other accredited banks to ensure that they remain safe and frozen.
All right. So what you're saying is that there do seem to be some sort of synergies between the
One bank to
different.
the other bank. Yeah.
Yeah.
Before they get the license to do that, they need to sign such agreements.
Okay. I'm just going to take one more parent question, Doctor. This is from Shaida, and she asks, "What if I go into preterm labor?"
So, as I just mentioned, whenever you go into preterm labor, since you have informed your gynecologist about the same, I think it really doesn't matter. We can still go ahead with the stem cell banking. There will be you can collect the cells
And
even if
can
you go, and we are not going to kind of interfere with the delayed cord clamping. So as the parent rightly mentioned, I think she must have read that in preterm labors the baby's weight is just 32 weeks. So in order to ensure that the baby gets enough blood from the mother, we do something called as delayed cord clamping. So we are not going to interfere with the delayed cord clamping just to get the cord blood cells. So delayed cord clamping is done for a minute, and after that only we are going to take the cells from the cord and the placenta.
Okay, Dr. Stara, I'm just going to move to our next question. Can stored stem cells treat genetic disorders the child carries? Genetic disorders, this is.
Yes, absolutely. Genetic disorder depend upon what, like thalassemia. Yes, it can be taken care. That's the whole reason that we are kind of that's why I just mentioned that it's the future. It does take care.
Can you delve a little bit into the kind of genetic disorders we can see stem cells treating, Dr. Sitara?
Like sometimes aplastic anemias or leukemias also can be part of the genetic disorders.
And what about very common genetic disorders such as, let's say, diabetes? Is that something that stem cells can also treat?
Yeah, that is the future. That's the most exciting thing about 2026. They have the regenerative medicine has a publication on it which says that type 1 diabetes, it kind of reboots the immune system, or any neurological issues such as autism or spectrum disorders, and also a traumatic brain injury, or sometimes also, it is just a research, but yes, we are looking into heart repairs, like regenerating the heart muscles after a defect or an injury.
That's really interesting. And is there a timeline to this? When can these treatments? When can people
These
have
are, these
access
are in
to
the
these?
trial. These are under trials, so it will take some time. But however, if you ensure that your baby stem cells are there, I think they will definitely be able to make use of it, if at all.
Okay. And when my parents need to access their banked stem cells, is there a specific time period?
No, there is no specific time period as such. It just the stem cells are there. Depends. See, you need to. That's what I said. That initially the amount every year you may have to pay a particular amount to keep it cryopreserved. But I think your stem cell banks are going to ensure that you are reminded about the same, and they're going to keep it safe.
I'm just going to take another uh, parent question over here, Dr. Sithara, if you don't mind. This is from Nancy, and Nancy asks, when is the ideal window to register for stem cell banking versus risking last minute rushes?
Yeah, the ideal is definitely in the early pregnancy. You need to, because you have ample time to think, read, kind of research about the different banks. So I think early pregnancy, that is up to 24 weeks, because after that you're in a different phase. Now you're getting ready to deliver. So I think the ideal time is the early pregnancy, and you'll have a lot of time to discuss with your doctor also.
We also have another question, and this is coming from Pragati. Pragati asks, for IVF pregnancies, does the collection process differ from a normal pregnancy?
Absolutely not. It's the same process. I just spoke about that. It's the same. IVF pregnancy, twin pregnancy, preterm birth, it's all the same.
All right. Thank you so much, Dr. Sitara. This has been such an invaluable session. There's been so much information shared. I'm sure parents now have a clear roadmap for stem cell banking decisions. And I hope we've been able to, through this session, answer as many questions as we could. And as I say that, we have another question that's come in. Who performs the collection and are they specially trained? This is from Seema.
This is the gynecologist usually perform it, or the sisters or the nurses who are assisting the surgeries or the deliveries. Even they are trained to collect it. It's a very simple process. So we don't. It's not, definitely not a rocket science. It's a very simple. We just take a needle, we insert it, and we collect it. So it's a very simple thing. Either the doctors or the nurses.
Yeah, I'm sure that the doctors play a very important role here in sort of assuring the parents that this is a safe procedure. I suppose it's also the doctor you see or the nurses that you meet and interact with who make you feel safe. Would you say that kind of interaction also is important to reassure parents before any procedure?
Yes, absolutely, absolutely. So we are going to make sure that the mother as well as the sisters are well aware about it, and we are just going to keep the mother. We are going to keep her in the entire process. That when we are collecting, we're going to keep her informed about it. It's going to happen right in her face if it is a normal delivery. If it is cesarean section, yes, at least a thumbs up will be told to her that we have collected, or it will be informed to her, to the person waiting outside the labor room.
And these are people who are specifically trained, right? Specially trained for this collection.
Yes, yes.
Right. Great. Thank you so much for answering our questions, Dr.
I
Sitara.
just want to add on to it. Your stem. There are certain stem cell banks which send their own people. Of course, they are usually standing right outside the labor room to collect their samples. Yeah.
Right. Is there any more information, Dr. Sithara, you would like to share? Some closing thoughts before we uh, close our workshop today?
So stem cell is the future, and there are many parents who are going for it. As I just mentioned, we think of insurance, but we do not want to actually claim it. The same way, this is one of the first gift that you're gifting your child, to ensure that if there is something that is treatable, you kind of tell your child that, okay, this is kind of a backup plan that we have. So no negative thoughts, it's just for the future. Keep I kind of advise all the parents that they need to understand this process. It's a very simple process. It is not harming both the mother and the baby. And going forwards, as I mentioned, that it is a regenerative medicine like type 1 diabetes or any neurological issues or heart repair. It is the future. So if you do have the access, then kindly go for it.
Yeah, I mean, I'm sure you get a lot of questions, especially from first-time parents, on the risks versus the reward, especially concerning new medicine and not having enough understanding for it. Is there any kind of advice that you give parents like that
So do
before
not be
they
worried.
jump
Do
in?
not be worried. We are not with the baby is not even doesn't even understand what happens because the baby is given off to the pediatrician. We are not harming both the mother as well as the child. It's just rewards and rewards.
I'm sure it is. Thank you so much, Dr. Sitara, for joining us today. And I would like to thank the parents for joining us today and sending in your questions. I hope we've been able to answer them to your satisfaction. I would highly recommend you consult your obstetrician for personalized advice, and see you all at our next session.
Thank you, Caroline. It was great having a conversation with you. Thank you, all the parents, for the patient listening.
Lovely talking to you, Dr. Sitara. Thank you so much.